course of my career, I've met many people who are struggling in different areas of their life, whether it be in a relationship, issues with parenting, or a personal issue such as depression or low self-esteem. Many people don't have the financial resources or time to devote to going to therapy on a regular basis. In hopes to meet the needs of those people, I created this podcast, Top 5 with Chris Taylor, where you learn the top 5 things that you can do right now to change that difficult situation in your life. On today's episode of Top 5 with Chris Taylor, we're going to talk about a really serious topic, and that's dealing with a child that's addicted to drugs. For those parents out there that are struggling to figure out a way through the relationship with your drug-addicted child, I empathize with you. It's heartbreaking to see your child walk down a self-destructive path, one that you desperately want to bring them out of, but you know you really don't have a lot of influence on until they sort of hit that proverbial bottom or make those choices themselves to remove themselves from patterns of use. But we're going to go ahead and get into the top 5 things that you can do in dealing with your drug addicted child. Okay, so number 1 is set clear limits. Now, oftentimes when we're hurting or we want something better for somebody, we give so much of ourselves and we just keep giving more and more and more, and we think that the more we give or the more we do is going to, sort of cause that final breakthrough and they're going to be able to change their life for the better. Honestly, with dealing with people that are addicted to drugs, that's just not always true. And in fact, it's rarely true. So I really encourage you to set clear limits, know what your boundaries are so that you don't over worry yourself, get to a place of burnout, and just really start harming yourself in that way, because we know the first things to go are adequate sleep, your diet suffers, you'll hold a level of anger and resentment, and that can start, sort of bleeding into other relationships. So we want to make sure that you're setting clear limits. Okay. Number 2, communicate with love. So you're setting limits. You can still communicate, obviously, this is your child, and you always want to express love, right? Because ultimately, you can't control this person. You've probably been in a situation where you've been so frustrated because you just desperately want them to stop, and you have all these rationalizations for why they should, and intellectually but we know that drug addiction acts on those parts of the brains that are sort of, irrational and pleasure-based. But there's no reason that you can't communicate with love, because really communicating with love keys in on some of those same pleasure areas. So we just want to, not that we're gonna, counter the effects of drugs, but, you can touch in on the same place and hopefully, give a sense of safety and a desire to have more of that, in your life, okay? The number 3 thing that you can do is name the manipulation. Now, what I mean by naming the manipulation, I think those of you that are struggling with a drug-addicted child, you know that there's just such a high level of manipulation. Whether it's money, whether it's a place to stay, it can be really anything. Maybe it's just getting into your house to steal things so that they can sell to buy more drugs. So what I say is name that manipulation. Let them know that you know what they're doing. It's not going to stop them from doing it, but it's going to set, again, like we talked about number 1, that clear limit. And they're going to know that this isn't going to happen, and this is why it's not going to happen, because you know what they're trying to accomplish with it. Now, I'll be honest, there's probably going to be a lot of anger and even a more desperate sense of manipulation that follows that. So you're going to have to practice and really stay strong in being able to do that, okay? So the 4th thing that you can do is probably what you've been doing anyways, but number 4 is offer to get them help. Now, a lot of times when people are addicted to drugs, they, sort of verbally say that they like doing drugs, they enjoy it, they don't see a reason to stop, it gives them a sense of pleasure. We know that it's probably not making them feel that great. They're doing things that are sort of against their character, and people generally use as a way to sort of numb some of that, deep emotional pain that's been unresolved for some time. So offer to get them help. Now, they'll probably refuse it and reject it, but it'll allow you to know that you've done what you can to try to help the situation. Now, you offer to get them help,
but they have to be able to receive that help. So you can move to a place of a sort of an in-your-face intervention, and whether those work or not is sort of 50-50, because people that are avoidant of that emotional pain, if you sort of key in on that guilt and shame around that, that can push them away further. And that's why I said earlier, really make sure that you're always communicating on love. But look at rehab centers, look at different opportunities that they can get counseling and therapeutic support around their addictive behaviors, okay? And the fifth thing that you can do is allow for communication. Now, sometimes we get so angry and so frustrated because our child is just not listening, they're not stopping doing drugs. You see them losing weight, engaging in high-risk behaviors, and sometimes just the easiest thing to say is, if you don't stop, then we're done. And that, again, can really key in onto some of those unresolved emotional issues that they're already struggling with. And it can push them to a point where, they may start using more. And that's not to put the responsibility on you that you're sort of causing an increased use, because obviously we don't want you to be holding any negative feelings. But allow for communication. They're still your child. You can know what they're doing is wrong. You can know that they're not seeking help around that. But you can move to a point where the communication is there, and hopefully over time there's a window or an opening where you can step in and give that help that you really want them to receive. Okay, so those are the top 5 things that you can do today to help deal with a drug-addicted child. If you liked what you just saw, and you would like more information about how you can implement these top 5 things into your life right now, please check out this and additional videos on my website, www.christaylormft.com.